Alabama's hospitals are seeing a rise in COVID-19 hospitalizations as the highly contagious Delta variant spreads throughout the state. As of Thursday, there were 367 adults and hospitalized with COVID-19 in the state, up from about 250 adults a week ago. There are currently 9 children hospitalized with COVID in Alabama. The head of the Alabama Hospital Association, Dr. Don Williamson, said it's a problematic trend. "We have a very susceptible population under the age of 65 with very low vaccination rates," said Williamson. Earlier this month, the association said 94% of COVID patients in Alabama hospitals were unvaccinated. For unvaccinated individuals, they are likely to be exposed to the virus. Among the samples of virus sequenced at UAB, 71% were identified as Delta variants, the university reported this week. The variant is at least 4 times as infectious as the original COVID-19 strain. As of July 7, Alabama's average daily case count was 275. By Wednesday, that number was at 529, a 92% increase in the past week, Williamson said. "It's not surprising we've seen a similar increase in hospitalizations," he said, adding that hospitalizations are skewing towards younger people. According to Williamson, 39% of people hospitalized with COVID-19 were in the ICU as of yesterday. Williamson said he expects cases to continue to rise in Alabama similar to what's occurring in Missouri and Arkansas, although he does not believe the hospital system will become overwhelmed because the majority of the state's older population has had a vaccine. "Hospitalizations are increasing, frankly, more rapidly than I had anticipated. I still believe that we will be able to avoid the huge spikes, like we saw in January," he said. "The greatest concern for Alabama," he said, "is the possibility of a vaccine-evading mutation emerging, given the rapid spread of the virus and the low vaccination rates in the state." Last week Alabama dropped to last place nationwide for its vaccination rate with 33.4% of its total population fully vaccinated. "The great long-term concern is we have a reservoir that, God forbid, could actually be the source for the emergence of a vaccine-resistant variant. That's the nightmare scenario," said Williamson.